The trauma bay at Seattle Memorial was a hierarchy of loud egos and sharp elbows, a place where the quiet were eaten alive. Chloe was the new nurse nobody noticed until a blacked-out Navy Sikorsky SH-60 Seahawk touched down on the roof, and the military demanded her by name. Seattle Memorial Hospital was a relentless machine that fed on chaos and adrenaline. As a Level 1 trauma center, it attracted the most brilliant, arrogant medical minds on the West Coast, and the nursing staff was a tightly knit pack of wolves. To survive in this emergency room, you had to be loud, aggressive, and perfectly willing to throw your weight around. Then there was Chloe Evans. Chloe had transferred to Seattle Memorial 3 months ago, and in that time, she had mastered the art of being entirely invisible. Standing at 5'4" with her dark hair permanently pinned back into a severe no-nonsense bun, she was the epitome of unremarkable. She never joined the break room. Gossip never complained about the grueling 12-hour shifts, and never ever pushed back against the senior staff. Her scrubs were always immaculately pressed, the sleeves worn uncharacteristically long despite the stifling heat of the trauma bays. To charge nurse Brenda Higgins, a 20-year veteran who ruled the ER floor with an iron fist, Chloe was nothing more than a glorified supply runner. "Evans!" Brenda barked, slamming a clipboard onto the nurse's station counter. The metallic clatter cut through the ambient noise of heart monitors and paging systems. "Bed 4 needs a bedpan and someone threw up in the waiting room. After you deal with that, restock the pediatric crash carts. The real nurses have actual traumas arriving." Chloe didn't blink. She simply nodded, her expression entirely unreadable. "Understood, Brenda." "And try to move a little faster today," Brenda muttered to another nurse as Chloe walked away. "I swear I don't know who signed off on her transfer. The girl has the urgency of a sloth." HR said she came from some Department of Defense administrative clinic back east. Probably spent the last 5 years filing paperwork and handing out ibuprofen to veterans with mild backaches. The harsh whisper wasn't meant to be private, but Chloe didn't so much as break her stride. She was used to it. She preferred it. Invisibility was a shield. Later that afternoon, the ER doors blasted open as paramedics wheeled in a victim from a multi-car pileup on Interstate 5. The patient, a man in his 40s, was gasping for air, his chest rising and falling in erratic, terrifying spasms. Dr. Thomas Garrett, the hospital's golden boy trauma surgeon, strutted into the bay like a king entering his court. He was brilliant, undeniably handsome, and carried an ego that required its own zip code. "What do we have?" Dr. Garrett demanded, snapping on his gloves. "Blunt force trauma to the chest, blood pressure is tanking," a paramedic yelled over the din. "We couldn't secure a solid airway in the rig." Brenda pushed her way to the front, barking orders at the junior staff to clear the way. Chloe, as usual, was relegated to the back corner of the room, tasked with preparing IV bags and staying out of the way. But her eyes, sharp and analytical, were locked onto the patient's chest. She noticed the slight tracheal deviation, the asymmetrical rise of the left lung, the distended jugular veins. It was a classic tension pneumothorax. The man's lung had collapsed and trapped air was crushing his heart. He had seconds before cardiac arrest. Dr. Garrett, however, was fixated on the monitors. "Push 50 of rocuronium. I need to intubate now. Somebody get me a Mac 4 blade." "Dr. Garrett," Chloe said softly from the corner. "Not now, Evans." Dr. Garrett snapped, struggling to position the laryngoscope. "His throat is swelling. I can't see the cords. He doesn't need intubation yet," Chloe said, her voice remaining perfectly level but cutting through the panic like a scalpel. He needs a needle decompression. Left side second intercostal space. His trachea is deviating. Dr. Garrett froze, looking down at the patient's neck. A flash of realization and embarrassment crossed his face. Chloe had already stepped forward, silently sliding a 14-gauge angiocatheter needle directly into his gloved hand. She hadn't rushed. She hadn't panicked. She had simply anticipated the exact medical necessity and placed the tool directly into his palm before he even had to ask. Garrett plunged the needle into the patient's chest. A sharp hiss of escaping air filled the room. The patient's heart rate immediately stabilized the monitors, shifting from a frantic red alarm to a steady rhythmic green. The room let out a collective breath. "Good catch, Doctor," Brenda said, beaming at Garrett. "You saved him right at the buzzer." Garrett handed the bloodied needle back to Chloe without making eye contact. "Yeah, keep the crash cart stocked, Evans, and don't interrupt me again while I'm assessing a patient." Chloe calmly disposed of the sharp, stripped off her gloves and walked out of the bay. She didn't ask for credit. She didn't seek validation. She went straight to the waiting room to deal with the vomit, just as Brenda had ordered. But as the evening dragged on, a strange, suffocating tension began to settle over Seattle Memorial. The rain outside turned into a torrential downpour, lashing aggressively against the heavy glass windows of the ambulance bay. The police scanners, usually buzzing with local chatter, went completely dead. At exactly 8:45 p.m., the secure red phone at the charge nurse's desk, a line that had not rung in 4 years, began to flash. Brenda picked it up, her annoyance shifting rapidly to pale-face shock. She slowly placed the receiver down, just as Hospital Director Miller sprinted out of the elevator, his tie askew. "Clear Trauma Bay 1. Miller shouted, his voice cracking with unprecedented panic. "Divert all civilian ambulances to Mercy Hospital. I want this entire floor locked down. Nobody gets in or out without my authorization." Dr. Garrett stepped out of the break room, a cup of coffee halfway to his mouth. "Director, what's going on? Is it a mass casualty event?" "No," Miller said, visibly shaking. "It's a military medevac, Tier 1 asset. They bypassed the base at Lewis McChord. They're coming here, 3 minutes out." The rhythmic chest-rattling vibration hit the hospital before the sound did. Coffee spilled over the rims of mugs in the break room. The hanging surgical lights in the trauma bays began to sway. Then came the deafening, monstrous roar of military-grade twin turboshaft engines. Outside, the rain-slicked windows, a massive Sikorsky SH-60 Seahawk helicopter, painted entirely in matte black, with no identifying civilian markings, descended from the stormy sky. It didn't land gently. It slammed onto the reinforced concrete of the rooftop helipad with the aggressive urgency of a war zone extraction. Inside the ER charge, Nurse Brenda Higgins was frantically waving her arms. "Move everyone! Move Evans! Get out of the hallway! Take the soiled linens to the basement! I don't want you anywhere near this patient. We need our absolute best on the floor." Chloe silently picked up a basket of linens and stepped backward into the shadows of the supply alcove. She didn't go to the basement. She simply watched. The double doors of the elevator banks blew open. 6 men poured into the sterile, brightly lit hospital corridor. They were not paramedics. They were massive, heavily muscled men wearing waterlogged tactical gear, Kevlar vests, and drop-leg holsters. The metallic scent of rain-jet fuel and fresh blood instantly overpowered the hospital's sterile bleach smell. In the center of the formation, they pushed a specialized military gurney. On it lay Lieutenant Commander Liam Caldwell. Even practically destroyed Caldwell looked like a weapon. His combat shirt had been shredded open, revealing a torso painted in crimson. A massive field tourniquet was cranked so tightly around his right thigh that it was biting into the muscle, yet blood still dripped heavily onto the linoleum floor with every rotation of the gurney's wheels. He was delirious, his eyes rolled back, his massive hands thrashing wildly against the restraints. "Clear the perimeter!" roared the lead SEAL, a towering man with captain's bars barely visible under a layer of grime. "I need a trauma surgeon right damn now." Dr. Garrett puffed out his chest, stepping directly into the path of the incoming military unit. "I'm Dr. Thomas Garrett, Chief of Trauma. Bring him into Bay 1 and step back. My team will take it from here." "Like hell we will," snarled the Navy corpsman, gripping the gurney tight. "He's bleeding through the combat gauze. The femoral artery is shredded and he's hypovolemic. We need a massive transfusion protocol and a Reboa balloon inserted before you even think about moving him to an operating table." Garrett's face flushed bright red. "Listen to me, son. I don't care how you play doctor in the mud. This is my hospital. You will step away from the patient, or I will have security remove you." The captain stepped forward, entirely ignoring Garrett's authority, his hand resting casually but menacingly on the grip of his sidearm. "If you try to remove my men, doctor, I will personally throw you through that plate glass window. Fix my commander." They forced the gurney into Trauma Bay 1. The civilian medical team swarmed in, but it was pure chaos. Caldwell was incredibly strong, and his delirium made him fight the very hands trying to save him. He snapped a restraining strap like it was made of cheap plastic. His fist clipped Dr. Garrett's shoulder, sending the surgeon stumbling backward into a tray of instruments. "Restrain him!" Garrett yelled, his composure shattering. "Push 5 milligrams of midazolam. He's going to bleed out if we don't hold him down." "Sedatives aren't working," Brenda shrieked from the corner, terrified of the giant thrashing soldier. "His heart rate is 200. He's going to code." The SEAL corpsman was desperately leaning his entire body weight onto Caldwell's leg, trying to stem the arterial geyser. The tourniquet is failing. The windlass is stripped. Garrett froze. He looked at the blood. He looked at the heavily armed men screaming at him. He looked at the dying hero on the table. The Golden Boy surgeon completely locked up. The situation had bypassed his textbook training and entered the realm of raw, unfiltered combat trauma. From the shadows of the hallway, Chloe Evans dropped the basket of linens. She walked into Trauma Bay 1. She didn't sneak in. She didn't hover in the back. She walked with a terrifying absolute authority that parted the panicked nurses like water. Brenda saw her first. "Evans, are you insane? Get out of here!" Chloe ignored her. She walked straight up to the towering SEAL captain, who immediately moved to block her path. Chloe looked dead into the captain's eyes. She didn't raise her voice, but the cold, jagged steel in her tone cut through the shouting. "Stand down, Captain Reynolds. Your man is bleeding out because your corpsman failed to secure the secondary proximal junction." Captain Reynolds stiffened his eyes, widening as he looked down at the diminutive nurse. Nobody outside of Naval Command knew his name. "Who the hell are you?" Chloe reached up and casually ripped the pins out of her hair, letting the tight bun fall. She pushed her long sleeves up past her elbows. Etched into the skin of her left forearm was the unmistakable, highly classified, dark ink insignia of the Joint Special Operations Command Medical Unit. "I'm the one who patched up your team in Kandahar 3 years ago," Chloe said coldly. Now step aside before you lose your commander." Reynolds drained of color. He instantly took a step back, snapping his boots together. "Yes, ma'am." Dr. Garrett stared, mouth agape. "Evans, what do you think you're doing?" "Shut up, Thomas!" Chloe snapped, her voice cracking like a whip. It was the first time she had ever spoken out of turn, let alone used his first name. "Grab a pair of forceps and clamp the distal end of that artery, or get out of my trauma bay." She moved to the table. Caldwell was thrashing, swinging a massive bloodied fist blindly toward her head. Chloe didn't flinch. She caught his wrist in midair with shocking speed, pressing her thumb brutally into a very specific nerve cluster on his radial artery. Caldwell gasped his arm instantly, going numb and dropping to the table. She leaned down, her face inches from the delirious soldier. "Liam, it's Nightingale. Stand down, soldier. That is a direct order." Caldwell's bloodshot wild eyes locked onto Chloe's face. The monitors, which had been screaming a chaotic rhythm, miraculously began to slow. The hulking Navy SEAL blinked through the haze of pain, his chest heaving. "Nightingale," Caldwell rasped, his voice trembling as he stared at the quiet nurse. You're here." "I'm right here, Commander," Chloe said softly, grabbing the failing tourniquet with blood-soaked hands. "Now go to sleep. I've got you." The trauma bay descended into an unnatural, breathless silence. The only sounds were the rhythmic pumping of the ventilators and the steady artificial beep of the cardiac monitor, which had miraculously slowed from a frantic scream to a manageable, albeit weak, rhythm. Caldwell's massive chest rose and fell in a drug-induced hypnotic tempo. Dr. Thomas Garrett stood completely frozen, his expensive surgical loafers planted in a puddle of blood, his mind desperately trying to process what he had just witnessed. The hospital's most submissive, unremarkable nurse had just neutralized a thrashing, highly trained Tier 1 operator with a single touch, commanding him with a call sign that sounded like a ghost story. "Don't just stand there, Thomas," Chloe said, her voice dropping the polite, deferential tone she had maintained for 3 months. It was replaced by a cold, metallic authority that sent a shiver down charge nurse Brenda Higgins's spine. "His femoral is shredded, but that's not the primary issue. Corpsman, give me the tactical ultrasound. Brenda, I need a Reboa kit, a 7 French sheath, and 4 units of O-negative blood on a rapid infuser. Move." Brenda, who had spent the last 90 days treating Chloe like an incompetent intern, scrambled to the supply cabinets with the frantic obedience of a terrified rookie. She didn't question the order. She simply ran. "Evans, you can't insert a Reboa balloon here." Garrett finally stammered, his ego desperately trying to reassert itself. "You're a nurse. That's a highly invasive endovascular procedure. You have to do it under fluoroscopy in an operating room, or you'll rupture his aorta and kill him instantly on this table." "He doesn't have time for the elevator ride to the OR, doctor," the SEAL corpsman growled, handing Chloe the portable military ultrasound scanner. "And she's not just a nurse." Chloe didn't bother looking up at Garrett. She pressed the ultrasound probe against Caldwell's groin, her eyes locked onto the tiny pixelated screen. "We do this blind in the dirt under heavy artillery fire, Thomas. I think I can manage it in a sterile, well-lit room." "Needle." The corpsman slapped a long, terrifyingly thick, hollow-bore needle into her waiting palm. Without a second of hesitation, Chloe drove the needle into Caldwell's femoral artery, navigating the mangled tissue by pure tactile feel and the grainy ultrasound image. Her hands were incredibly steady, moving with a fluid, terrifying precision that only came from years of operating in the most catastrophic environments on Earth. Garrett watched in absolute horror, and then slowly in undeniable awe. The technique was flawless. It was the work of a master trauma surgeon, executed by a woman he had yelled at that morning for restocking cotton swabs too slowly. "Guide wire in," Chloe muttered, sliding the flexible wire through the needle and into the aorta. "Balloon catheter following. I'm inflating in zone 1, ready for occlusion." She depressed the syringe, inflating the small balloon inside the largest artery in the human body, effectively cutting off all blood flow to the lower half of Caldwell's body. The immediate geyser of arterial blood from his thigh wound sputtered and stopped entirely. The monitors instantly chimed in a healthier tone as the blood pressure in his heart and brain stabilized. "Occlusion achieved," Chloe announced, her voice flat. "Brenda, start the rapid infuser. Let's get his volume back up." "Done," Brenda whispered, her hands shaking as she connected the blood bags. She stared at Chloe as if looking at a stranger wearing a familiar mask. "Now," Chloe said, finally looking up at Dr. Garrett. "Clamp the distal artery, Thomas." Garrett swallowed hard, stepping forward with his forceps to do as he was told. He reached for his standard Bovie electrocautery pen to seal the smaller surrounding vessels. "Stop!" Chloe barked, her hand shooting out to physically grab his wrist in a vice grip. "Do not touch him with that cautery." Garrett bristled, his face flushing crimson. "Listen to me, Evans. You may have pulled off a neat trick with the Reboa, but I am the chief of surgery here. I need to cauterize these bleeders." Captain Reynolds stepped into the light, his massive frame towering over the surgeon. He reached into his tactical vest and pulled out a heavy lead-lined containment box, slamming it onto the metal tray next to the operating table. "If you use an electric charge on his leg, Doctor," Reynolds said, his voice terrifyingly calm, "you will detonate the micro-shrapnel embedded in his muscle tissue, and you will turn this entire hospital wing into a crater." Garrett dropped the cautery pen as if it were a live rattlesnake. "What? They weren't hit by a standard mortar," Chloe explained softly, maintaining her grip on Caldwell's wound. "They were hit by a highly classified experimental proximity munition. It shatters into tiny volatile kinetic batteries. If you introduce an electrical current, they cook off." She looked back down at the wound. "Corpsman, give me the ceramic forceps." The corpsman handed her a specialized pair of non-metallic composite tweezers. The civilian medical staff watched in absolute breathless terror as Chloe leaned close to the shredded muscle. Her eyes narrowed in intense concentration. With millimeter precision, she navigated the ceramic tips deep into the bloody cavity. The room was so quiet that the sound of the rain lashing against the windows sounded like gunfire. A tense, agonizing minute passed. Chloe's brow furrowed, but her hands never trembled. With a sickening squelch, she pulled her hand back. Pinched between the ceramic tips was a jagged piece of dark metallic composite, no larger than a dime, but humming with a faint, terrifying thermal heat. Chloe smoothly dropped the fragment into the lead-lined box. Reynolds immediately slammed the heavy lid shut and locked it. "Explosive ordnance removed," Chloe said, exhaling a long, steady breath. "All right, Thomas, now you can use your cautery. Close him up." It took Dr. Garrett 45 minutes to repair the shredded femoral artery and close the massive wound on Caldwell's leg. During that entire time, nobody spoke unless it was absolutely medically necessary. The hierarchy of Seattle Memorial's emergency room had been violently, permanently inverted. Dr. Garrett, the reigning king of the trauma ward, worked with the nervous, sweaty precision of an intern being graded on his final exam. Chloe stood at the head of the bed, monitoring Caldwell's vitals, occasionally issuing quiet, undeniable corrections to Garrett's technique. When Garrett finished the final suture, he stepped back, stripping off his blood-soaked gloves. He looked exhausted, completely drained of his usual swagger. "He's stable," Garrett said quietly, refusing to meet Chloe's eyes. "The Reboa balloon is deflated. Blood flow to the leg is restored. He's going to keep the limb." "Good work, doctor," Chloe said. It wasn't a compliment from a subordinate. It was an evaluation from a superior. Hospital Director Miller, who had been hovering nervously in the hallway, finally found his courage and stepped into the trauma bay. He clutched a clipboard defensively to his chest. "Listen here, Captain Reynolds. I understand this was an extreme emergency, but I have federal protocols to follow. I need identification patient records and a full incident report before I can allow you to transfer this man to a military facility." Reynolds didn't even look at Miller. He was busy watching his men meticulously pack up their specialized gear. "Director Miller, the events of the last hour are classified under a top-secret national security directive. In exactly 3 minutes, my team is walking out of those doors with Commander Caldwell. If you try to stop us, I will have federal agents seize this hospital, confiscate all your servers, and place your entire staff under indefinite, non-disclosure detainment. Do we understand each other?" Miller turned incredibly pale, the clipboard slowly lowering to his side. Yes, understood." Reynolds nodded, satisfied. He turned his attention back to the diminutive nurse standing by the head of the gurney. He reached into his assault pack and pulled out a heavy dark green tactical jacket bearing the subdued insignia of the Joint Special Operations Command. He held it out to her. "We didn't just divert to Seattle Memorial because it was the closest Level 1 trauma center, Major Chains," Reynolds said quietly. The use of her rank echoed loudly in the quiet room. "We diverted here because intelligence flagged your location 3 weeks ago. We knew you were hiding out in the civilian sector." Brenda Higgins let out a small, involuntary gasp. "Major." The woman she had been treating like a servant was a highly decorated field officer. Chloe looked at the jacket, her expression hardening. "I told command I was done, Reynolds. I did my time in the sand. I wanted a quiet life. I wanted to just take temperatures and stock bandages. The quiet life doesn't suit you, Nightingale." Reynolds countered, his voice softening just a fraction, revealing a deep, battle-forged respect. "And command didn't send us to drag you back for a desk job. The munition that hit Caldwell, it wasn't a random insurgent attack. It was a new biological kinetic hybrid weapon. There's a facility in Eastern Europe manufacturing them. We're spinning up a black operation to dismantle it in 48 hours. Reynolds took a step closer, his eyes intense. "We need our chief medical officer. Caldwell's team won't deploy without you. You're the only one who knows how to keep us alive when this tech tears us apart." The trauma bay fell completely silent. The rain outside continued its relentless assault. Chloe looked down at her civilian scrubs. They were stained with Caldwell's blood. She looked over at Brenda, who was staring at her with wide, terrified, deeply apologetic eyes. She looked at Dr. Garrett, whose fragile ego had been shattered into a million irreparable pieces. This hospital was supposed to be her sanctuary. But standing here surrounded by the arrogant squabbles and the petty drama of civilian medicine, she realized Reynolds was right. She was a ghost pretending to be human. She belonged in the dark. Chloe slowly reached out and took the tactical jacket from Reynolds. She slid her arms into the heavy material, the familiar weight of the combat uniform settling comfortably over her shoulders. She reached up to the collar of her scrub top, unclipped her Seattle Memorial Hospital ID badge, and let it drop onto the blood-stained linoleum floor. The plastic clattered loudly in the silent room. "Pack him up!" Chloe ordered, her voice ringing out with the absolute authority of a JSOC major. "We're moving!" The SEALs moved with practiced, terrifying efficiency. They unlocked the wheels of the gurney and began pushing Caldwell toward the elevator banks. As Chloe turned to follow them, she paused at the threshold of the trauma bay. She looked back over her shoulder at the stunned civilian staff. "Brenda," Chloe said, her tone perfectly calm. The charge nurse jumped slightly. "Yes, Evans, I mean Major." "Bed 4 still needs a bedpan," Chloe said softly. "And you're out of pediatric epinephrine on the 3rd floor crash carts. You'll have to restock them yourself today." Before Brenda could formulate a response, Chloe turned and walked down the hallway, flanked by the heavily armed military unit. Dr. Garrett, Director Miller, and Brenda Higgins stood in absolute silence as the elevator doors closed. A minute later, the monstrous roar of the Blackhawk's engines spooled up to maximum power. The vibration shook the dust from the ceiling tiles of the trauma bay as the massive, unmarked helicopter lifted off from the roof, disappearing into the violent Pacific Northwest storm, taking the quietest nurse they had ever known back to a war they would never see. From an ignored wallflower changing bedpans to a highly classified JSOC major taking absolute control. Chloe's terrifying transition left the arrogant hospital staff completely speechless. She proved that the most dangerous people in the room are often the ones making the least noise. Did you see that explosive micro-shrapnel twist coming? Let us know in the comments below. If you want more intense, real-life drama stories like this, hit that like button, share this video, and subscribe for more.